Okay, good. All right, so welcome to the Weekend Health Talk. Today we have a special presentation, and it's one of the things that is will continue to grow. This is an industry that will continue to grow, and we are blessed to have an expert in the field to talk to us about this, and that is about aesthetics. All right, it's about augmenting um, your looks, optimizing your looks to your desired specifications. It's about correcting certain blemishes that may happen as a result of a disease process, an accident, or something that has happened during the course of your life. So we need to know as individuals how safe the procedures are and how to make sure the procedures that we may subject ourselves to are safe. And what will be the recommendations? And the best person to tell us that is an expert in the field, who is a friend, a brother, who is an aesthetic physician specialist, Canadian board certified. He holds an executive MBA, one of the best graduating from his class. He is a business mogul. He is certified by the Chartered Institute of Marketing Ghana. And please, it is great pleasure I introduce to you Dr. Bright Redu from the Bliss Clinic. Doctor, over to you.
Yes, thank you very much, Dr. Albert. Indeed, I'm very grateful to you for this wonderful opportunity to be on your program. And also thank you for the good work you've been doing. Medical advocacy is certainly an important thing, and your field work is also very crucial given today's socioeconomic environment. Mental health is a huge deal, and so I really admire you for all the good work you've been doing, and I'm really honored to be with you on your platform today. So thank you for the kind introduction. My name is Dr. Bright Redu, Canadian Board Certified Aesthetic Doctor. I'm also a member of the American Academy of Aesthetic Medicine. So today, I'm glad Dr. Albert is, pardon me, my network is a bit sketchy, so I'm not going to do video. So I'll just speak without my video showing. So I'm going to talk about, let's dive into it, okay? So what's the importance of aesthetics? And by and large, as we grow, the body falls apart. From age 25 all the way upwards, we will have changes. These are things we cannot fight. Is the nature of our reality and how God created us. The body starts falling apart. And so, there are things we can do to prolong, our youthful appearance and also slow down aging. So basically, aesthetics goes hand in hand with anti-aging. And I am an aesthetics and anti-aging doctor. It doesn't make sense to be making a client beautiful when they are not well within. So we focus on the internal health of the client as well as the external appearance of the clients. But take for example, you have a vehicle, a car. Dr. Albert, I'm sure your Mercedes-Benz, you've kept it in very good condition. You've been servicing it and maintaining it regularly, right? Likewise, the human body. You need to go for monthly yearly checkups or checkups whenever maintain yourself. Also to take care of your external appearance. In the past, people who sought aesthetic services were, people who were on TV or celebrities or the very rich, who needed to keep their youthful appearance because their line of work, may require them. If you are shooting a franchise, or a movie, or a series, you need to keep your looks, keep your weight. So they were really involved in that. Even Queen Elizabeth in her early days, when I remember when she toured Africa back then, she used to smile so much that she had spasms on her face, and they gave her botulinum, injections. That was Botox, right? So aesthetic treatments really have come a long way, to help us. Some people too have, issues with their appearances that they're not comfortable about. And, it affects their self-esteem, self-acceptance, self-confidence. And it affects how they perform at work, how they relate with their families, their children, their husbands, their spouses, in the society at large. So if these people do not, have the mental ease, or they're not at peace with themselves because of their looks, now they have an option to do something about it. So aesthetic procedures really do a lot more to people. It doesn't just take care of the external looks, but it takes care of internal battles they are fighting. And I know that Albert is very much aware of these things, that these battles that are fought in the minds of customers who seek these treatments. Now, not to say everybody who comes to an aesthetic clinic has an internal conflict, but by and large, if things affect us, if you have a broken front tooth that affects your confidence in speaking, you may not be confident at work. It now affects your overall performance. So it's gaining grounds, really. Worldwide, aesthetic procedures, have become very popular among patrons. Africa is still an emerging market, and Ghana is still growing. So people are becoming increasingly aware of the aesthetic and procedures. Now, one of the major concerns in aesthetics in Ghana is that it appears the beauticians, those who run the spas, were the ones who took up aesthetics far ahead of medical doctors. And so there are very, very few qualified medical doctors, very few, a handful actually, that are qualified to provide aesthetic services. When I talk about aesthetic services, we have the surgical and non-surgical. For surgical, our bosses, the plastic surgeons, are the ones who are qualified to play in that area. But there are a lot of non-surgical things that we don't do surgery, non-invasive things that we can do, Botox, fillers, so many of these things that a lot of doctors in Ghana are not in this area. And so it basically the charge has been led by beauticians and spa owners and cosmetologists, and this sometimes presents a challenge to people. Okay, so these are clients that I've worked on. These are before and afters of clients. So the common procedures are Botox, which is a very simple procedure. We inject a neuromodulator that relaxes muscles to stop you from, frowning your face, forming wrinkles when you move your face. And that is because as we age, we produce wrinkles on our face. So you see these wrinkles here and this wrinkle and all these wrinkles. When we relax the client's muscles, they don't form those wrinkles. Now the challenge is that if you keep forming those wrinkles as you age, those wrinkles become very deep. And then, whether you move or you don't move your face, they are there, and it affects the beauty of the client. So when you do Botox treatment, it actually slows down the physical external aging of the face. As somebody will say, right? Then we have the fillers as well. So over here, I'm sure you can tell the difference. This lady looks quite tired here. When you do the filler work here, she looks fresh and youthful. So this was the under eye area, which has gone down. So these are one of the two most common procedures that we do in aesthetics. So my specialty is basically non-surgical. Aesthetics means we don't do surgery. I'm not going to do plastic surgery on someone. We work with, products and fillers, all sort of things. Okay. Yes. Lasers. We do skin treatment. We do cosmetic dermatology. We do neuromodulators. We do fillers. All these things are there, right? So why does safety matter? Safety matter because safety is everything. Safety is everything. I keep telling my clients, I'm focused on you being safe. It doesn't matter when you are beautiful and you're not breathing. It doesn't matter to us. So safety is everything, right? But one of the reasons why safety matters is that this is one of the anatomies that one must know before you inject the face. The face contains blood vessels in a very complicated network. And therefore, imagine somebody who has not gone to medical school, who has no health, medical training, it's not a nurse. The person is injecting people's faces. The things that can go wrong. And in markets where aesthetics has developed and procedures are done on a large scale, these things are happening there. So this is an example of what we call the vascular occlusion, where you inject a filler, like the filler, for example, we've done filler work here, as you can see the under eye. We've done some filler work here, as you can see the under eye, right? So you must know your anatomy carefully. And so you imagine you inject filler somewhere around the lips and you inject into this artery. Okay, the filler will block the artery, and blood is flowing to the artery to a part of the body. Once you block the artery, you get necrosis. The tissue where the artery is supplying will die. And there are signs that and this can happen even to a medical doctor. It can happen in the best hands, and it has indeed happened to people. But the thing is that medical doctors know their bounds. I know my bounds, and I know how to treat complications. A trained aesthetic doctor knows the complications, knows the techniques to use to minimize the risk of having those complications, knows how to identify the complications in a very early stage and treat it before it becomes bad. And if even something bad happens, he can call on his colleagues with their resources, plastic surgeons and others to come in and rescue the situation. So I find it very alarming when I see people who have no medical training, no health yet. They're not nurses. They're not in the health professional or the para or the allied health profession, injecting faces because somebody has taught them something for 1 day or 2 days. And that is very dangerous, right? Now, These are examples. For example, if you inject filler, okay, into somebody's nose, the upper part of the nose or the forehead, there is a risk of the filler entering these vessels over here. Okay, we have these vessels over here that communicate with the retinal artery, the ophthalmic artery. Okay, these vessels over here. So if you inject filler, and in this diagram, it looks very simple, but in a real life person, it is not this simple. The filler can therefore go back and then block, the ophthalmic artery, and what you get is irreversible blindness. So if a client comes to me asking me for a nose filler in the upper part, it's in my consent form. I tell the client this risk. And in fact, I have talked clients out of doing the procedure. Though I can do it, I tell them I don't think it's worth it because your nose is not that bad. I don't want you risking going blind once every 2 years. It's not worth it. I'll tell you it's not worth it. There are times where I will talk a client out of a procedure because I don't think that the risk is worth the benefits. I'm not about collecting money and doing it for the clients. And so these are the fine lines where you need to know who you are talking to, okay? And this is a lip filler gone wrong. We put fillers in the lips to make the lips, more voluminous, more sensual, more succulent and delicious to look. And sometimes when you're injecting the filler in the lip, it's not as simple as you see it here. The artery has, the way artery behaves inside the lip, you can inject it into the artery and it will cause problems there. And so this is an example of a vascular occlusion, a lip artery. This lady has had a lip, filler done. And this is one of the things that you see. So luckily for her, she was in the right hands and therefore they were able to handle this issue for her. Now let's look at, I didn't come to, I came to tell you real life stories, okay? So this happened this year, July, where a 22-year-old woman undergoing Botox enlargement surgery dies within 10 minutes of being given anesthetic by unqualified beautician in Russia. And you realize that I repeat again, the main issue is that the beauticians are the ones who are really in that space. There aren't too many doctors in Ghana, in Nigeria, in many places. In the US and Canada, they're very strongly established. For example, in the US and Canada, a nurse cannot treat patients on her own. You have to be a nurse prescriber. There are no nurse prescribers in Ghana. So, and as a nurse, you have to go and then do another, certification to become a nurse prescriber where you're allowed to work, to a certain point without being supervised by a medical doctor. Then, so nurse prescribers. So the Canadian board, for example, doesn't train nurses. You have to be a nurse prescriber or a medical doctor before they'll train you. But there are other places where there's no or very poor regulation where any Tom, Dick, and Harry, Ajua, Kosia, Mansa can go there and get a 1 week program, 1 week, and come back with a certificate that they are certified to treat people. And they have no clue what they are doing. They haven't had 7 years of rigorous medical education. They've not had 10 years of experience as a doctor, and they've been certified by somebody. So you are comparing somebody's quality education to somebody who runs a salon, right? And some of my clients do not know the difference. The ones you see, so this is the victim, and this is the beautician who did it. All right. Now let's go. You can see I've seen people injecting, and one of the things that people do here that I see in Ghana is they'll call me that, doc, we want to do bad filler, and they want to use some oil. People are using progesterone oil, some use mineral oil, others use silicone. Now, only two products are really approved for doing butt fillers. When I say butt filler, if you want to fill your butt, there are things you can do. For example, you do the BBL, where you do a liposuction. The surgeon will go and suction your own fat from your body, prepare the fat, and inject it into your butt. That's the Brazilian butt lift, BBL. Then we have the liquid BBL, where we use fillers, to do that. And the fillers, they are hyaluronic acid filler, what we call Sculptra, and then what we call Sculptra. These are the fillers that are used. We don't use oil, we don't use any progesterone oil. All these things are able to put some silicone or some black market substance there. And ladies today are desperate, to have very cheap procedures. These are the long-term effects. Okay, so this is a 54-year-old woman who had mineral oil injected in a bottle 7 years ago, and complications have arrived. 48-year-old woman who had oily material injected into her buttocks. They will come in, they want some 100 mils, 1,000 mils. I don't do that. Okay. Now this is this case, the lady who had the oil injected. You can see that she's having complications here after a while. It looked beautiful in the beginning, but after a while, there were problems. So this lady had to go and then have surgery where they had to excise the, it's terrible. All right. Then some too do implants, but they don't do the implants right. They go to people who are not qualified because the people are cheap. Okay. This is one very sad one. Bride to be dies after botched liposuction at a Malaysian beauty salon. Why do you want to do a liposuction at a salon? Liposuction should be done by a trained medical doctor. You cannot let somebody who is in a salon, who hasn't gone to medical school, do liposuction for you. But the doctor is charging $7,000. That woman is charging you $500. So you want cheap, right? But this is safety first. Safety, absolutely safety first. Okay. There was a case of an Australian lady. Australians, they have very good, well-regulated aesthetic, industry. And this lady told her parents she was going for a vacation somewhere in New York, in the USA. She ended up going to Mexico for a liposuction, where she had her lungs punctured 5 times and she died. Very, very, very sad. And this is not a lot of it happens. People go to I don't want to mention names. People go to some countries, go to far and wide, and they get bad procedures. Okay. So safety is indeed everything. I'll continue sharing news with you. Okay. So death of Bay Area women after botched BAT injection highlights illegal surgery risk. Tamira Mosley left BAT injection. Clients dies at Liberty Hotel in. This this person left this client in a hotel to die. I mean, if you can go to YouTube and check some of it's scary. It's scary. So let me take you to woman dies after surgery after getting black market BAT injections. And a lot of Ghanaians are getting all sorts of things. When they reach out and I tell them the price, it's like I'm speaking alien language to them, when they seem shocked. It appears most clients do not research. I have clients who come to me and they tell me, when you mention the price, they are in shock. And they didn't research the price. And I ask if I'm going to buy something in the market, Dr. Albert, if I'm going to buy, say, a new Mercedes, this year Mercedes, whatever class, I will certainly look at the prices online, have an idea before I go to the showroom. They come to the showroom, when you mention the price, they are in shock because they don't seem to have an idea of the cost. And the thing is that aesthetics is an expensive, industry to be in. Okay. So woman dies after botched breast surgery at a Sydney beauty salon. Ministry of Health probing case of women losing vision after dermal filler treatment. This is the blindness I was talking about. So when you come to me, I will most likely not do a filler in the upper part of your nose for you because filler lasts 18 months. I can stretch it to 2 years. So once every year and a half, you have to come and do that filler, unless we do more permanent filler work for you. And there's a risk of going blind, all because I want to correct a little kink in the nose. I may refer you to somebody else who is more comfortable doing it, but we'll let you know the risk. And that risk can occur even in the hands of a very trained, competent person. It can happen to anybody. All right. Woman who performed deadly BAT lift procedure charged with. So this person basically had somebody who died. Now let's look at this one. New HIV case linked to vampire facial at Mexico spa. Now this is not in Mexico. This is in the US, New Mexico, USA. They tracked an outbreak of HIV that were all linked to a particular spa. The spa was called Vampire Facial. And I can guarantee you that there was no doctor in this so-called medical spa. Okay. So, doctors have a training and we have clear conscience. There's no way that I'm going to be using needles I've used on other clients. Come on. The doctors know how to sterilize their, even nurses will sterilize their equipment. So what happened was that they were spreading HIV in that clinic. Either they were injecting one needle, different people, they were sharing some products that somebody's blood had touched with other people. You understand? Beautician whose patient died after liposuction had fake medical. Can you imagine? Bronze beautician arrested over death for illegal BAT injection. Unlicensed beautician jailed in New York accused of killing patient with botched. I can go on and on and on and on and on. And so after a country has had these issues, but Ghana is emerging. I know in due time regulations will kick in and all that, but it's up to clients to be aware to understand what is happening. I'm going to show you a few things. So one of the main issues is cost versus quality. Cost versus quality. People want it cheap, and they sacrifice safety, for cheap. That's a problem. So I give an example here, okay? Now, if you want to do a BBL, liquid BBL, the product's called Sculptra. Given that a vial of Sculptra filler costs about $1,000 and 4 to 7 are used, this non-surgical lift can cost anywhere between $3,000 and $6,000. Okay, this article is comparing. Now this says Diamond BBL, 12 vials of Sculptra body filler for $6,000. This package is based on adding volume or augmenting the shape. Gold BBL, 6 vials for $4,000. Okay, now this is Sculptra. Sculptra is quite expensive, okay? But how it works is that aside filling you up, it also stimulates your body to form new tissue to fill you up even more. So it improves over time, right? And some people want a slow, natural, evolving change. So you do Sculptra, and then their face feel nicely with their own tissue, okay? Stimulates the tissue to grow. You form new collagen that fills the place up. All right. Now, this is BBL using hyaluronic acid filler. Okay. Now, over here you can see that the 100 ml, okay, this is in the UK, a place in the UK. It costs £3,000 and it's on promotion for £2,500. So when clients come to me, I don't know what they know. Other people are injecting oils into their buttocks. People are putting also, some people are putting hot pots. They put fire in a pot and put on their buttocks and all sort of things they are doing. When I tell the client that I'm charging 100 mil, 10,000 Ghana cedis for 100 mil or 15,000 100 mil, they are in shock. They look at me like I'm crazy. And I like, oh, so these clients have no idea. So this is the cost. It's expensive, right? And sometimes you're better off going to do the surgery, but maybe you don't qualify for surgery because you don't have enough fat. You don't have fat on you. You're a slim, skinny person. You don't have fat on you for the surgeon to harvest. For you to have a Brazilian butt lift, they must take your fat and inject into your buttocks. You don't have the fat. So where are they going to get it from, right? So you don't have the fat, and you may need to do some treatments, or the client is somebody who has got a contraindications to doing surgery. Maybe they have other issues. So therefore, this is the best option for them. You understand? So these are some of the reasons why that people go for, and other people go to people who put all sorts of things in. They don't care to ask, what are you injecting me with? As long as the buttocks is out and it's pumped and it's nice, they're okay. But then 2, 3, 4, 5 years down the line, you start having complications. That's the issue. So again, it's caution. Aesthetics is perceived to be a very lucrative industry, and a lot of people jump into the place for the money. So there are also not a lot of doctors in this country, in Ghana and even in Nigeria, who are into aesthetics. So there's a huge sort of underserved market, sort of, if I'm to say. And so a lot of people who don't have the prerequisite qualifications are jumping into the market to take advantage. So for me, it's safety precautions first, absolutely. And some of the things is that you know is that when you go to a place that is proper, the doctor or the practitioner will take his time to explain everything to you. You understand what you're going to be doing. There's a proper consultation and assessment. The person will ask about your medical history. Do you have any allergies? Have you had surgeries before? Have you done any cosmetic treatment? For example, if I do a filler work, right, and a filler work goes bad, there's a product for dissolving a filler. Now that product, people tend to be allergic to it. I must do a test, an anaphylactic test, before I give the products to you. And sometimes when you're allergic to wasp or bee, so I ask them, do you eat honey? They eat honey. They have no bee allergies. I may be able to use that product safely on them. So we take a detailed medical history to understand the clients we are dealing with. We take measurements, measure your BP, you measure your weight, check your body mass index, monitor things. There are times that we catch diabetics. Who do you know they're diabetics at our clinic? And when we see somebody who has a high risk for diabetes, we do and we investigate. There are people who come to us, they are serious hypertensives, they had no clue they were. We pick it up. So you can walk into a place, somebody checks your blood pressure, then they start giving you medications and start doing things to you, right? Then there's an informed consent. Before we do anything to any of our clients, we explain to the client what we're going to be doing, the side effects, the risk, how long it will last. We tell the clients alternatives that are available to them. Then they give us their permission to go ahead and do the procedure. We use strict. I have an OCD for this. Strict, aseptic techniques is what we use in our place. because the last thing you want to do is a fit person coming to you for a procedure, they end up with an infection. We are very thorough, very thorough. We are very strict about it. Okay. And we select correct products. We refuse to use the wrong products for clients. If the clients can't afford it, it's fine. We are not going to be injecting some oil into people's buttocks. So we choose to use the right products that are more expensive. But at the end of the day, we know our client is going to be safe. And then, of course, we use techniques that minimize risk. We cannot eliminate risk 100% in an aesthetic procedure. Anything can go wrong. Okay, but we use the safest techniques that are available according to current standard operating protocols to make sure that our clients receive the safest care that we can provide at our end. Now, signs of unqualified providers. Okay, now sometimes clients don't know the difference, and elsewhere, people are published. For example, if you go to the Canadian Board of Aesthetic Medicine and you look for the board certified members, you find my name there. You can go type my name and I'll show up with my location and the service I do. You can check the Medical and Dental Council Ghana, the Gazette. Qualified doctors' names are published, and these are things that you can check. Okay, ask your doctor, what's your qualification? You have the right to ask. You understand, before they treat you, or ask the person, are you a medical doctor? You can ask if you have any general healthcare practitioner. You can talk to them. Can you check on this person for me? I want to know whether you understand. So someone you go to unqualified people, you can tell by the way they talk to you, when you ask them questions, they cannot give you straightforward answers. They don't seem to understand what they are doing. You could pick some of these things up, And unsafe facilities, number one is the facility is not HEFRA approved, okay? HEFRA approved. HEFRA is the agency that approves hospitals and clinics, and healthcare facilities. So you can look for that sign. And the HEFRA approval, there'll be a medical director's name, and there'll be a HEFRA, certificates there. That's supposed to be displayed by law. You should look for that, okay? And sometimes too, you can pick some things like, sometimes I can tell they're not. If somebody's going to be performing something on you, and they're not cleaning your skin well, they're not wearing gloves, they're not using aesthetic techniques, you can tell that there's something to be off. All right. And then I think that sometimes we can talk to our doctors to recommend people for us to see. So when do you seek medical attention? If you're uncomfortable with anything in your body, or you want to learn, just can talk to an qualified aesthetic practitioner and have a conversation. Start from there. You can go online and read, answer all your questions, and then you can take it from there and then do some of these things. Now, in our practice, some of our clients, it's not just about the looks, but also we need to provide some other form of care, and so we work with other specialists. We work with plastic surgeons, we work with general surgeons, we work with psychiatric specialists like Dr. Albert, because we give a holistic care. Some of the clients, they don't have a particular blemish on their bodies, but sometimes people have laughed at them from their child. When I was young, they used to laugh when I had big lips. It was always this laugh. When I was in JSS, my classmates would laugh at me. They gave me one crazy nickname I used to hate. When I was young, I had very large ears. But when I was growing up, it became fashionable for people to inject filler into their lips. Who would have ever thought? So beauty is sometimes just the trend of the day. So at the end of the day, if you're uncomfortable about something, speak to a doctor. And I think that you should go to an aesthetic clinic and get your treatment from there, not a beauty salon. Beauty salons have their own, level to which they can offer you care. But to try and do bath lifts and liposuctions in a salon is a highly risky endeavor. And so I would encourage everybody to start by talking to doctors. There are qualified doctors in Ghana now. There are qualified aesthetic plastic surgeons in Ghana now. There are specialists in the major hospitals I have bosses who are into that. And so don't shy away from coming to doctors. Do talk to doctors. There are doctors who are into the industry now in Ghana. And I believe that you get quality care, right? So Dr. Albert, in aesthetics, we don't speak too much we do more of pictures. So I show the pictures, I show the complications, I show some work, and I'll wrap it up here. So basically, life is all about balance. At the end of the day, we balance safety, health, and then aesthetics. I care about the overall well-being of my clients. So we provide holistic care. This picture here basically shows the frown lines you can get and why we do Botox. Okay, so in this case, for example, we can do this is called a nasolabial fold, and it's called marionette lines. We can fill this area here nicely or do some treatments. Okay. Now I won't put a filler here. I can do other things here, but predominantly what we do here is mostly Botox injections. And then you can treat this what we call the crow's feet. Okay. So there's another client that I saw. She had under eye hollowness and she had wrinkling, severe wrinkling, very dry, skin with very, poor collagen under the skin. And then she came in for some treatments, this is her 2 weeks after, and the face is settled nicely. You can tell that certainly she looks fresher here than there. And sometimes too, the clients do not want any, serious change in their appearance. Some clients are very conservative and prefer to be private. They don't want people to know there's an obvious change. So we do very subtle treatments, so that they look different, but you can tell they've done something. So I bring the presentation on end, and I say thank you to Dr. Alberts for the good work you're doing and for having me on your show. I believe that this will be the first one. There will be definitely a sequel to this where we shall show more and perhaps leave the forum for questions and answers. So thank you so much, my boss. I appreciate it. Thank you.
Thank you very much, Dr. Brache. We appreciate you. You've opened our understanding, you open our eyes to what to look out for. Because the point is this industry will continue to grow and the services are highly needed. And like you said, lots of people have resorted and are resorting to beauty salons, spas, where the procedures are being carried out by unqualified personnel. The need for us to know that there are qualified, even though they are few, you are one of the very, very, very extremely few people qualified to do certain procedures. We appreciate you so much. Thank you very much. All right, guys, if you have any question, you can drop in the chat box where if you have any question. Yes, somebody says she has some questions to ask. Yes, so Linda, you can chat on either send it to me on WhatsApp or put in the chat box on Zoom. I will read out for Dr. Bright. Dr. Bright, if someone wants your services, do you have any contacts? If you can drop on the
absolutely.
The yeah,
absolutely. I can do that. I can do that. But then I can drop it here in the.
So you can just drop it as a slide on the PowerPoint for anyone who wants your services. If anybody has any questions, please feel free. Drop it in the chat box. Dr. Bright will answer any questions that any of you have. I was having some technical challenges, but working on it. So we have the recording that will be uploaded as well on our YouTube channel quickly for as many people who also want to listen and watch the recording. So Dr. Bright will get us the contact of the Bliss Clinic where he works. He's the medical director there. He is fully qualified. I know Dr. Bright. He is my colleague, and I know how much he pays attention to detail, and it is all about evidence-based medicine. He will not just do the procedure for you because you are coming to him. He will do the proper things that has to be done. I can vouch for him anytime. So yes, the contacts of the Bliss Clinic is on our screens. If you have any questions, please drop it here on the chat box or on WhatsApp. I'll read it out to Dr. Bright to answer. So if anybody has any questions, please feel free. The contact of the Bliss Clinic is there for us all to see. All right, so if you have any questions, please feel free and drop it. I know a lot of people didn't know that things like this can be done in Ghana safely. He is trained and certified to perform certain procedures safely here right here in Ghana, and is getting more. Dr. Bright, will there be more procedures that your outfits can perform in the coming years? What should we
Absolutely,
expect?
absolutely, sir. Absolutely. So, we'll be starting liposuction next year. Actually, we are doing our certification for it. But with liposuction, we'll start with chin submental. Some people have got its pattern on their chin. We need upper arm liposuction. And then if you have upper arm, some people have got this sagging skin there. And then we're also working closely with several major hospitals and specialists in the country. So for those who require more extensive treatment, it requires more intense care. So we do it together with other specialists in the country. So we are on, yes. So if you can come to us, we also do laser skin treatments, skin rejuvenation, skin anti-aging. We treat acne. We do most of we do hip dip. We do so next year. Generally, we'll be starting fat lipo and fat transfer. If you want to put some fat inside your face, to make it nice. If you want to slim your jaw, some people have got very some people have got very broad face. What we call the masseter, the jaw muscle. When you clench your teeth, that muscle over there, it's called a masseter. Some people have got very large masseters, so it makes their face look very bulky. We do jaw slimming. There's so much you do. There's so much you do. So now what we do, the clients don't even know is when the client comes to us that we offer the solutions to them. There's so much that we do. Botox can also be used to treat migraine headache. One of the after resistant migraine that doesn't respond to conventional medical therapy, it comes to take Botox. Botox can be given for all this neck stiffness, all torticollis, back pain. Botox is used for hyperhidrosis. Some people sweat excessively in their armpits. Very bad, excessive. Some people have got excessive sweat in their palms. Okay, when they shake your hand, it's always moist and slippery, always sweating, and on their feet as well. We call some people have got the vagina is too tight that they cannot engage their husbands. Okay, we inject Botox there to relax, the vagina so they can enjoy sex. Of course, we also do vaginal tightening. This is science-based. When you come, we check your vaginal pressure, and then before and after, and the pressure can be about 100. After the treatment is 200. And when you go and engage, you realize that yes, something has happened there. You understand? So there's so much. We do orgasm shots. Some women are not able to enjoy sex or have orgasm. We do treatments. We do vampire facial where we use the blood, we extract the healing components in the blood, and use it to reach within the skin. We do IV anti-aging treatment, IV glow. We do treatments that enhance, male sperm count. So we have so many treatments at our disposal that we do. We do treatment for alopecia, those who are balding, right? So there's a lot that we do. So we do laser, we do cosmetic dermatology, we do dermal fillers and neuromodulators, all sort of things. You have quality products that I can use, skincare products that I can use as well. So there's so much that we do, and we are looking forward to expanding, and by God's grace, putting up the first 100% dedicated aesthetic hospital. That only all we do there is aesthetics. So we are excited about the future, and we know with God leading the way, we shall prevail. So that clients can come for very safe procedures. You don't have to travel to Turkey or Colombia or Venezuela where you are there alone. People can afford their hotel bills. You can afford it. It's terrible. People get all sorts of things and then they come back. So that's our goal, is to try and offer quality services right here on our homeland so that we can feed the West African sub-region. That's the vision that we have.
All right. Thank you very much, Dr. Bright. The question that was posed, the person said you have already answered the question during your presentation. Thank you very much. Now, let me just confirm. So far, all the procedures that you do at the Bliss Clinic, are they day procedures? I mean, the person walk in today and go back home to the same day, or the person has to be admitted?
They're all day. We don't admit. They're all day. They're all day procedures.
Okay.
You come in, maximum is about 3 hours. You go back.
Okay.
Yes. So they're all day. Yes.
Okay. All right. Thank you very much. Almost all the people are saying the questions they have has all been answered during your presentation. And of course, there'll be a sequel where you're going to tell us more. Of course, there's more coming. You say you're going to start like construction next year. It's going to be very, very interesting to have a center fully dedicated to aesthetics right here in Ghana, where safety is assured. That has always been the problem. safety, safety, safety. And it's great to know that we have someone who has safety as the core thing that we focus on. Thank you very much, Dr. Bright. We appreciate your time here and your expertise. Of course, now you've shared your contact, you've shared your social media handle as well. Of course, people who need your services will be referred, and those who also want to personally contact you will do so. We appreciate you so much. Do you have any final words for us, please?
Well, my final word, first of all, I thank you. I thank the participants who are here with us. And I say do pay us a visit. And I also entreat my colleagues who will be hearing this to jump, enter the industry. Aesthetics is exciting, and you can come in from whichever background. Because we have, for example, we have cosmetic gynecology, there's cosmetic urology, there's dermatologists can definitely do that. There's cosmetic dentistry. So I mean, we also treat a bit of dental when people have what we call the gummy smile. We inject Botox to help the the way the teeth appears. We do all sort of interesting things. So clients should seek treatment from qualified people. And I'm also entreating my colleagues to look at aesthetics. It's an emerging market. The demand is huge, and we need more hands so that we can provide safe, procedures. So thank you so much, and I appreciate all of you. Thank you.
Thank you. We appreciate it so much. Thank you so much. So for those of us who are joining us late, or those who have been listening or watching this recording, we appreciate you as well. The recording will be